Hello there, this is Jana Santos.
Hello, this is Nichole Mims.
Today we will be talking about infection control in the operation room environment.
So specifically, our target population encompasses young adult patients undergoing surgery in the operating room. Patients entrust medical professionals with their mental and physical health. It is extremely imperative when patients are scheduled surgical procedures and will be sedated under generalized anesthesia. Patients do not have a say in their care after this point and rely on the knowledge and expertise of the surgical team members.
Post-operative patients that contract a surgical site infection have a 2 to 11 times higher chance to die from infection complications. Infection control is a practice that requires teamwork and good hygiene execution. Nevertheless, so many post-operative patients must face serious consequences for poor decisions made by the healthcare providers every day inside of the operative rooms. The literature exemplifies the prevalence of infections in the operating room. The safety priorities for patients regarding prevention of infections starts the moment the patient enters the pre-op unit. Post-op patients carry the algorithm of how well the infection control on a particular operating room is done. From a small simple procedure to an open heart surgery, patients rely their outcomes in relation to surgical site infections to the good practice of all healthcare providers in their care.
Statistics show that the incorrect use or absence of personal protection equipment, otherwise PPE, is one of the main reasons for surgical site infections, as well as staff traffic increases considerably aerosolized particles, compromising the quality of air inside of the operating room. So we must show gratitude to the innovation and technology that we have in the United States. The resources available to quality of care and healthcare education should not be taken for granted. Many low-income countries do not have access to education and infection control guidelines. It will take persistent alterations to surgical regulations and guidelines to reflect the current quantitative and qualitative data surrounding surgical infection evidence.
In conclusion, life or death are the only two outcomes coming from an operating room. Surgeons, nurses, and all the healthcare team can all give their very best treatment, and yet, if not compliant with the infection control good practice, are adding another variable that can interfere on both outcomes. A pledge for good infection control practice should be done among healthcare providers. The room for error when dealing with life or death is zero. Nevertheless, the statistics shows otherwise. It's a teamwork and a team effort, and yet a personal choice to do what is right.
Did you know that over 1 billion of the world's population is vitamin D deficient? That is including most of young adults. It puts you at a higher risk for infection and also lowers your immunity. So we definitely want to remember any patients going to surgery.
Remember, drink your vitamin D.